Today is Friday, June 12th, and we want to provide you with a few updates. Since the county declared an emergency on February 27th, we have been monitoring the COVID-19 pandemic from the Emergency Operations Center, or the EOC. We are continuing to provide accurate and helpful information to the public, provide resources to cities, fire districts, and our local partners, and sharing details on how we can all do our part to keep each other safe. Clackamas County successfully entered Phase 1 of reopening on Saturday, May 23rd. Before applying for Phase 2, we must maintain the metrics of Phase 1 for 21 days, as well as meet new guidelines set out by the governor. However, Governor Brown just announced a one-week pause on reopening applications. We still have work to do to meet the Phase 2 guidelines, but we are moving in the right direction. In addition to the work of the county, entering Phase 2 is strongly contingent upon the impacts of the virus. If Clackamas County is going to reach Phase 2, we need to work together, and here is how. Maintain appropriate physical distancing, wash your hands, wear face coverings when out in public, stay home when you are sick, even if you are only experiencing minor symptoms or just aren't sure. And if a contact tracer calls you, please answer the phone. Contact tracing is a vital part of how we track the virus and keep it from spreading. Our epidemiologist, Sunny Lee, will explain to you how contact tracing works and why it is so important.
In the most basic sense, a communicable disease epidemiologist is a public health professional who works to investigate and ultimately limit the spread of disease. At Clackamas County, my coworkers and I have been hard at work trying to limit the spread of COVID-19 in our community. One of the ways we do this is through contact tracing. The process of contact tracing for COVID-19 cases is similar to what we would do for some other contagious diseases like measles or tuberculosis. When a case is identified, our team, which includes myself, a program manager, nurses, and disease intervention specialists, will open an investigation. These investigations begin with phone interviews to learn how a person may have become ill and if anyone else they know shows signs of being infected. We also ask about where they've been and who they've had contact with to determine the risk of additional infections. If the person is in a high-risk category, like a healthcare worker, we notify their workplace about the exposure, assist them in enacting control measures, and help with testing to prevent future outbreaks. Sometimes we work with outside agencies on our investigations. For example, if an infected person has been on an airplane, we notify CDC, the Centers for Disease Control and Prevention, and they determine who is sitting near them on the airplane. When we identify someone who may have been exposed, we follow up with phone calls to find out if they're experiencing any symptoms. We educate them on what signs to look out for and how to keep themselves and those close to them safe. We work with the county's EOC, or Emergency Operations Center, to make sure that anyone who is isolated has the supplies and resources they need to stay home. Fortunately, we found that most people are cooperative and willing to take the steps necessary to help stop the spread of COVID-19. Reaching out to each contact can take a long time, and we may not be able to reach them by phone. After several attempts, we may try other means such as texts, emails, or a letter. Rest assured, we strictly follow HIPAA laws and do not leave any private information in a message. Contact investigations are a core function of public health, and we work very closely with our local, state, and federal colleagues to ensure the safety of our community during this coronavirus pandemic. This pandemic touches every part of our community, and it's as a community working together that we will get through these difficult times. Stay home and stay safe.